maybe I'll take a step back and say that immunotherapy has revolutionized the way we take care of lung cancer patients, be they non-small cell or small cell. Most patients will now be treated with chemo in addition to immune therapy at diagnosis. But the truth is, we are beginning to understand that patients, not all patients will benefit to this. The PD-L1 level is very relevant, and those with high PD-L1 will do really well and will live beyond 2 years with chemoimmune therapy, while patients with lower levels of PD-L1, no expression of PD-L1 within their tumors, will do about as well as they did with chemotherapy alone. So there's certainly a need for better therapies, in particular for that group of patients. The problem is that we need to begin to select these patients out and study them. And that's hard because frontline trials are usually the clinical trials that patients are joining right at their diagnosis. They're very scared. They want to get started on treatment really quickly, and chemoimmune therapy is appropriate. But I will encourage the investigators throughout the Sarah Cannon network across the United States oncology community to continue to find ways to select for better therapies for those patients. How are we going to do that? Well, next generation sequencing is critical, and there's no secret to the importance of this in lung cancer. We now have oral targeted therapies for about 8 different molecular subtypes based on the presence of these oncogenes. We call them EGFR, ALK, ROS1, BRAF. In 2020, we added MET and RET to that group. And I would say in 2021, we'll add likely HER2 as well as KRAS to that group. And in particular, patients that are found to have these oncogene drivers that can be found with next generation sequencing molecular profiles are probably better off receiving these oral targeted therapies as compared to chemoimmunotherapy, which is the sort of standard of care default. So doing the next generation sequencing early is critical. Finding those patients that will benefit from chemoimmune therapy versus an oral targeted therapy is crucial. And so encouraging streamlining of that testing, encouraging frontline clinical trial participation, those are some of my goals for 2021 for the lung cancer program at Sarah Cannon.